Hi, I'm Savannah Nix,
And I'm Madison Puckett.
and we're third-year medical students at OSU, and we will be presenting over the use of sensational language in news articles regarding diabetes treatments.
So going into the background of our project, as you may know, the news and media are highly utilized sources of providing health information to the public. And based on incomplete or inaccurate information, the risk and benefits of those medical therapies can be misunderstood by the general public. These misunderstandings are further propagated by the use of superlatives to describe those therapies. The primary objective of our project was to determine the frequency of superlative use in news articles that were discussing therapies on diabetes management. And our secondary objective was to determine the superlative frequency with the therapy's phase of development and also determine the HON code status of the news sources using those superlatives.
Our methods were adapted from a previous study, and more details on that investigation can be found under reference number 5. We used Google News to conduct a search of news articles published between June 16th, 2019 and December 16th, 2019. We searched for 11 pre-specified terms, which included breakthrough, cure, game changer, groundbreaking, home run, life-changing, life-saving, marvel, miracle, revolutionary, and transformative, along with diabetes drug. Articles were excluded if they did not include a superlative. We also searched in each article for reference to Health on the Net Code of Conduct, which is a platform used to verify health information online.
So the results of our study showed we had 62 news articles meeting inclusion criteria from 39 different news outlets. There were 120 superlative terms describing 31 unique therapies for diabetes management. The highest frequency of superlative use was describing tepalizumab, and the majority of the articles were written by journalists. 44 of the 62 articles were written by journalists. And therapies in the clinical trial phase had the highest superlative frequency and were featured in the most news articles. And only one of the news outlets was HON code registered.
Based on the results of our study, we determined that superlatives are very common when referencing diabetes drugs in news articles. Like Madison said, the majority of these articles were written by journalists that don't necessarily have a background in medicine and therefore maybe don't have the best understanding about the risks and the benefits of the drugs that they're discussing. Therefore, we have a few recommendations. First of all, we recommend that physicians and patients use caution when seeking health information online. And secondly, when physicians and patients do have to look into health information online, we recommend that they do so on websites that are supported by HON code. Additionally, we recommend that physicians join the Association for Healthcare Social Media, which is a nonprofit combating health misinformation online.
And we have included our contact information here. If you have any questions, please feel free to reach out to us.
Thank you.